then I'm currently, as you can see on the bottom right left, is the University of Putisas in Phnom Penh, Cambodia, where I'm an assistant professor. And on the lower right is International University, where I'm an adjunct clinical professor for orthodontics. So basically, I've been practicing for a while, and I would like to share some of my experiences with you this evening. And so let's go ahead. So like I like to travel, speak, I do a lot of workshops. My areas of interest mostly are basic tweed mechanics, aligners, finite element, airway biologies. These are just some of my basic interests in which I do like to speak, take workshops, as well as these are my areas of research interest as well. So I do like to move around. I'm constantly on the move. And then it's my pleasure to come across some of the prominent people in our field and exchange ideas, discuss a lot of things with them. These are just some of the workshops, my activities that I have been doing for the last few years. And okay, so basically let's start with the discussion today. So whether it's passive self-ligation, active self-ligation, conventional, we have some basic tenets of treatment planning or basic principles that we stick to. So some of them being, I'm sure most of you would be well aware of the Jackson's triad. Jackson's triad was basically aimed at three essential components when it comes to treatment planning. One, aesthetic harmony, functional efficiency, and structural balance. So it's the same that comes to what